You're shaking. Are you all right?
Just leave me alone!
Kelly Kapoor, a 35-year-old Indian-American Hindu, worked as a customer service representative at a local paper company. After recently completing chemotherapy, Kelly had collapsed at work in front of her coworkers and was admitted for complaints of overall weakness, disorientation, and pain, rated as an 8 out of 10 on the pain scale. This is a play-by-play of the events that transpired during her admission at National University Hospital.
Good morning. My name is Renee. I'm going to be your nurse today. What brings you in today?
Apparently I fainted at work. I don't know, I've just been really tired lately and out of it.
Okay, so you're feeling really weak. Are you in any pain at all?
Yeah, I'd say so.
Okay.
Everything just kind of hurts.
Well, when did it start?
I'd say it's been about a week now. I've just been feeling very not myself.
Okay, and where is it that you're feeling this pain?
I'm just tired and I'm achy and feel hot and then cold and then hot.
Okay, so I was looking at your medical history and I noticed that you were diagnosed with breast cancer and you've been going through some chemotherapy. How's that been going for you?
Yeah, chemo, it's been okay. I just haven't had much of an appetite, really. Everything just kind of tastes like mush.
Okay.
Yeah.
Okay, seems like I have everything I need. I'm just going to do a quick assessment, get some baseline vitals, and we'll see what labs the doc recommends, and we'll get those results back to you as soon as we can and see what we can do for you. Okay?
Okay.
Good morning, everyone. Just finished my assessment with the patient Kapoor. She's a breast cancer patient. This time coming in with a complaint of general fatigue and weakness. She's currently 35 years old, diagnosed with stage 2 breast cancer, and going through chemo since 2017 January. She states 8 out of 10 pain. Describes a recent fainting incident at work earlier today, leading to her seeking medical attention. And within a 4-month time frame, found that she's lost 38 pounds. Upon assessment, I found her hair was thinning, her eyes were becoming sunken, she had dry mucous membrane. Perla was good. She is alert and oriented, but a little slower response times. Her cranial nerves were intact. Her lungs were clear to auscultation bilaterally. Her heart rate was slightly on the higher end. Her pulses were weak and thready. Blood pressure definitely elevated. GI, the bowel sounds were hypoactive. Her urine was dark yellow. For musculoskeletal, she did have bilateral weakness to lower and upper extremities. Her skin had pallor and was hot to touch, as evidenced by the temperature that I also got. Her skin was moist. Some vitals of note: her blood pressure, again, 140/90, heart rate 92, respiration 16 breaths per minute, 99% O2 sat on room air, temperature 99.1, pain 8 out of 10. Her acceptable level of pain, according to her, is 0. Some labs that we also got were the albumin, which came in back at a 2.5, and an ANC at 452. So what do you guys think about what I've found?
Well, it's kind of worrisome that she's lost 38 pounds over the last 4 months, and looking at her albumin, it seems to be a little bit on the low side. I'm wondering if it has to do with nutrition.
Did she say how she was handling her chemo?
She was saying that it was okay, but her appetite was really diminished.
So maybe we could do some research into her background of breast cancer, like the pathophysiology, and make a nursing diagnosis and recommendations from there.
Sounds good. Let's definitely review.
Breast cancer is produced by a dysfunction in the cell replication cycle within a cell's nucleus. Most breast cancers are epithelial tumors that develop from cells lining ducts or lobules known as carcinomas. Breast cancer invades locally and spreads through the regional lymph nodes, bloodstream, or both. Potential risk factors include age, gender, breast density, family history, estrogen exposure, height, and previous benign breast tumors. Diagnostic tests include self-examination, mammogram, ultrasound, biopsy, CT scan, and MRI. Staging of breast cancer. Stage 1. Tumor measures less than 2 centimeters and the lymph nodes in the armpit are not affected. Stage 2. Measures 2 to 5 centimeters or lymph nodes in the armpit are affected, or both. Stage 3. Measures 2 to 5 centimeters and may be attached to structures in the breast, for example, skin or surrounding tissues, or lymph nodes in the armpit are affected. Stage 4. Tumor of any size and the cancer is spread to other parts of the body. Treatment. Chemotherapy is given before surgery to shrink the tumor. Promotes destruction of quickly dividing cancerous cells. Given IV, regimen can vary based on severity of cancer.
So looking at her overall assessment, I think that we should go over some nursing actions related to some of the problems that she's presenting, such as her chronic pain related to the progression of her disease and her reporting 8 out of 10 pain for 5 months, and her risk for infection based on her elevated neutrophil count at 452, but most importantly, her imbalanced nutrition, less than body requirements related to her poor food intake because of her chemotherapy. Maybe we should come up with some short-term goals that we should meet before she's discharged, and some long-term goals that she can meet after discharge to help with this. If you want to take over, Nicole.
Okay, sure. So let's start first by going over maybe some short-term goals. One being that she can maintain adequate nutritional caloric intake daily. So we can maybe offer her snacks and smaller meals throughout the day rather than giving her 3 large meals a day. It's easier to digest for her. And then since she is vegetarian, we can incorporate a plan that allows her to continue her cultural practices and food preferences while maintaining the proper nourishment. And another one is that she can ingest, we'll give her 1,700 calories a day and maybe 50 grams of protein a day. And so that way she gets the appropriate amount of calories and proteins that allows the body to maintain internal working activities and helps with growth, maintenance, and repair of tissues. And lastly, we could administer an antiemetic before meals as needed. So that way she can increase her appetite and retain her nutrients. Okay, so I think that's about it for short-term goals. Lindsay, do you have anything to say for some long-term goals
Yeah.
for her?
I think for a long-term goal, we should aim to return her to a normal BMI, which would be once she gains enough weight to be weighing 115 pounds. To do this, we could refer her to a dietitian or a nutritional support team. That way we can educate her and keep her accountable for what she's eating. We can also involve the patient in the planning and treatment of her meals, such as using a food diary. This helps her examine and monitor her food items and her eating patterns so she can plan for the meals. Also, we can assess to what degree her cultural and environmental factors may contribute to her nutrition. This way we can, because I know you mentioned that she's vegetarian, that way we can include include that in her diet. And lastly, she should be educated on health problems that could occur if a healthy diet isn't maintained. That way we can help avoid future health complications for her.
All right, guys, great suggestions. I'm going to take these interventions and have Kelly implement them as soon as she can, and we'll go from there. We'll see what she's able to do. All right, looks like patient Kapoor is on a positive track. She was able to meet her short-term goals by maintaining adequate nutritional intake, and that's evidenced by her positive INO, by maintaining a weight and maintaining her weight and gaining 1.5 pounds since her stay here. And she's also been able to consume the minimum intake, caloric intake that's necessary for her body and weight and height, which is around 1,700 calories. So I think she's ready for discharge, and we'll see what we can do from here.
Kelly Kapoor met with a dietary specialist after her discharge to create an adequate lacto-vegetarian diet plan with the proper caloric intake. Upon her 3-month follow-up, Kelly had gained back 9.25 pounds and had a BMI of 19. She met her long-term goal and was happy with the new dietary changes. 6 months later, she found out she was in remission for her cancer. She lived happily ever after. The end.